Hi, my name is Christy Ducey, and I am a nursing student with Indiana State University. Today I want to talk to you about access to healthcare in rural communities. Your learning objectives for this presentation are to describe disparities in rural healthcare, identify barriers to obtaining healthcare in rural communities, and to develop ways of increasing healthcare services in rural communities. But first, please pause this video and take the 10-question quiz linked below, then come back and we'll finish the presentation. Welcome back. Well, let's talk about some barriers to care. Rural populations are more likely to have to travel long distances to access healthcare services. This can be a significant burden in terms of travel time, cost, and time away from the workplace. Traveling long distances to reach a healthcare provider means taking hours off of work and causes many residents to delay or avoid care. Additionally, a lack of reliable transportation is a barrier to care. In urban areas, public transit is generally an option for patients to get to medical appointments. However, these transportation services are often lacking in rural areas. Rural communities also often have more elderly residents who have chronic conditions that require multiple visits to outpatient healthcare facilities. According to a 2017 report by the North Carolina Rural Health Research Program, rural populations have a lower median household income, a higher percentage of children living in poverty, and fewer adults with post-secondary educations, as well as more uninsured residents under the age of 65. Individuals without health insurance also have less access to healthcare services. An ability to communicate with your provider, or health literacy, can also be a barrier to accessing healthcare. Health literacy impacts a patient's ability to understand health information and instructions from their healthcare providers. This can be especially concerning in rural communities where lower educational levels and higher incidence of poverty often impact the residents. In rural areas, because there is little anonymity, social stigma and privacy concerns are more likely to act as barriers to healthcare access. Rural residents can have concerns about seeking care for mental health, substance abuse, sexual health, pregnancy, or even common chronic illnesses due to unease or privacy concerns. A shortage of healthcare professionals in rural areas of the U.S. also restricts access to healthcare by limiting the supply of available services, particularly limiting specialty services like mental health, substance abuse, and obstetrics and gynecology. This map of the United States shows that nearly every county has some level of primary health care professional shortage all across the United States. And this is primary care providers this year in 2021. Rural residents tend to be older. They have a higher incidence of cigarette smoking, high blood pressure, and obesity. Rural residents are also more likely to die from heart disease, cancer, unintentional injury, which includes opioid overdose, chronic lower respiratory diseases, and stroke. So what can be done? Well, there's a few things. We have freestanding emergency departments, and these are a facility that is structurally separate and distinct from a hospital, and they just provide emergency care. We can, of course, increase telemedicine. Increasing telemedicine takes care of transportation issues and even travel time to get to appointments, but It only works if you've got good internet service or an internet service at all available to you. Increasing specialty care, which is something that we're always working on. Community paramedicine. Community paramedicine is a model of care where paramedics and emergency medical technicians operate in expanded roles to assist with healthcare services for those in need without duplicating available services existing already within the community. Then there's the community health worker model. This model facilitates healthcare access by using community health workers, usually nurses, as a liaison between healthcare providers and rural residents to help make sure that their healthcare needs are met as well. Affiliation with larger healthcare systems is always helpful in rural healthcare clinics to be able to provide more specialty and more access to providers. That's not always a possibility. But then there are always state and federal programs to increase the supply of rural health professionals. Like I said earlier, along with the specialty care, they're always working to increase folks wanting to work in rural communities and provide medicine or particular care to those folks. In order to improve rural healthcare providers need to screen patients for high blood pressure and make sure that their blood pressure is well controlled. They should increase early detection of and prevention of cancers, encourage physical activity and healthy eating. This is to reduce obesity, promote smoking cessation. They should identify additional support for families who have children with mental, behavioral, or developmental disorders, promote motor vehicle safety, or any type of vehicle safety, which includes bicycles and bicycle helmets, and engage in safer prescribing of opioids for pain. Organizations that are working to improve rural health include the Federal Office of Rural Health Policy, the Rural Health Research Centers, which are funded by the Federal Office of Rural Health Policy, National Rural Health Association and National Association of Rural Health Clinics, the American Hospital Association Section 4 Rural Health Services. Then there are state offices of rural health and state rural health associations, as well as the National Organization of State Offices of Rural Health. And there's the National Rural Recruitment and Retention Network. So maybe you're interested in healthcare and you'd like to work in a rural setting, or maybe you already are a healthcare provider in a rural community and you want to improve access to services and the health of your community. You can work with these organizations to do just that. Thank you.